Hi, my name is Jeanette Langston. I'm the founder and director of Social Tinkering, a human connection project. I am here today with my friend Renee from the Southwestern Vermont Council on Aging, and we're here to talk to you about our Social Connection Survey. It's a very exciting project that we've been working on as partners with many other partners, and we want to tell you all more about it. So Renee, do you want to introduce yourself?
Sure. I'm Renee Beaupre-White. I'm the Community Liaison and Internship Coordinator with the Southwestern Vermont Council on Aging. And I've been with the agency a little over a year, and it's been wonderful to partner with Social Tinkering.
Yeah, cool. I'm so excited to be doing this. We've talked a while about coming on to PEG TV to share what we are all doing in regards to social connection to heal isolation and loneliness. So this is our first episode, hopefully more to come. The mission at Social Tinkering is to intentionally grow meaningful social connection to reduce isolation and loneliness. And we do that by asking our community what barriers are people facing. What are people's experiences of this, of social isolation, social connection, loneliness, and how can that experience guide the work? We ground all of that work in global research from around the world on these topics, and to pair the two, the lived experience with the research together to really help people thrive and help our communities thrive. Today we're here to talk about the Connection Survey. We have a survey going on for all of Rutland County through October 31st. This survey is asking people how are they feeling when it comes to social connection here. How isolated might they be feeling? How alone might they be feeling? We're asking these questions because we can't focus all the resources that we need to focus unless we know exactly what people are actually experiencing. So there's a lot of assumptions we can make from the science and the data that's from national and global, but we can't really help in our own community unless we ask our community how they're feeling. We're talking about meaningful connection, and Renee, why does the Council on Aging think meaningful connection is important to work on?
Yeah, well, we surely do, and it's wonderful to partner with Social Tinkering because again, we serve older adults, 60 and older in Rutland and Bennington County, and many of our older adults are living alone, and many folks aren't seeing many people or any people. And so we realize how vital it is that how vital connection is. We're social creatures. We need to connect, and so it's something that we see as many of our clients struggling with.
Yeah.
And so this has been just a wonderful partnership to have and to encourage our older adults to connect and to provide opportunities for them to connect. And we've partnered and hosted some Gather Together events, and we've helped sponsor and coordinate, which has been wonderful. And we look forward to having those, become even more popular and have more people attend and participate, because again, connection is just so important to all of us.
And we hear about connection in the news a lot. There's articles every day coming out. People see online and in the newspaper and everything. And a lot of times with social connection, they're saying, well, you need to go out and volunteer. You need to get out of your house. You need to go make friends. You need to join a club. But if we all were able to just join a club and do all those things, we wouldn't be in an epidemic of loneliness right now. So at Social Tinkering, we're asking, why aren't people joining clubs? Why aren't people feeling like they are able to easily make friends or meet friends? What is preventing us from feeling that connection? And you'll hear me say meaningful connection more than social connection. That's a distinction between a lot of the articles that are coming out. We really use meaningful connection instead because we know a lot of times you can have a car to get to an event. You can know people You can have family that you live with. You can have money to go take an art class. And you can still feel alone in that. So at Social Tinkering, we're really talking about how we're in relationship. So how we're in relationship with each other really matters. And all those other barriers, like having transportation, knowing people, knowing where to go, our health and all these things, those are important things we have to look at too, in terms of the things that might prevent us from feeling connected. But really at the end of the day, connection comes down to feeling seen and valued. And can we do that inside our own hearts? Can we do that with each other? And then in our community. So there's some data out there around connection, but not super specific. We've never really asked those questions of the people that live in Rutland County. And so we've been doing a few things over the last few years. We've done some projects, some advocacy work, supporting health equity efforts. We've done a lot of social meetups for the last 3 years, monthly social meetups, some discussion groups. But it's time to ask that question of our fellow Rutland County residents and say, what do you think is preventing us from growing this together? So the survey is going on now, like I said, through October 31st. You can access it online. It's on our homepage of our website, which will be up later, thesocialtinkering.org. If you go to the top of the homepage, there's a big button that says take the survey. We also have paper copies available for folks that need them. We're working with, gosh, how many partners do you think we have involved in this project?
Wow, many.
Probably at least 15 different organizations.
At least. I'm going to say even 20. I mean, I was thinking at least 15, yes.
Yeah, and every day more people. We were at Whoopie Pie Festival all day on Saturday. We had so many amazing conversations.
Project Vision.
And Project Vision last Thursday. So many people are helping to get the survey out. So you may hear about the survey from Mentor Connector, or Boys and Girls Club, or maybe even your therapist, right?
And I've been recently doing some classes at both CCV, presenting to classes at CCV and VTSU Castleton, where I've shared the survey. So we also have some younger folks filling this out too, completing the survey, which will be really great to have. Not just our older adults, but we really it'll be good to have a variety of ages to see.
Yeah, because social isolation and loneliness affects every single person. There are people that it can impact more. I found the more you've been exposed to experiencing inequity and discrimination, the more trauma that you've been through in your life, the more you're likely to experience isolation and loneliness. And all of us can experience it. Really, any economic level.
Do you want to describe the difference between loneliness and social isolation?
Yeah, I mean, there's a lot of talk about that. To me, social isolation is more, you're either intentionally being pushed out by a group or not being allowed in to a group. So there's that kind of cultural sense of social isolation where because of discrimination or something like that, you're not welcome or included in a space, or you don't feel welcome and included in a space, maybe because of things that you've been through in your past. And so there's the present not feeling welcome and included, and then there's the past stuff that prevents us from feeling that way. But then there's also the physical isolation of just living alone in your home. And we've talked to people who will say, I haven't seen I don't see another human being sometimes for a whole week at a time. We have people that, younger people. I know I've met a lot of younger people in my life that hang out in their rooms a lot, all day, and they've, run into not good experiences with other people, and that really wears on you after a while. And then we kind of self-isolate, in addition to the kind of cultural isolation, which can be worse in rural areas.
Right.
And I've heard in cities, just because you're in a city surrounded by people doesn't mean you can't be isolated there too. And in loneliness is more of just feeling alone. Our previous U.S. Surgeon General did a tour around the whole country and asked people how they were feeling in regards to these issues. And that's what generated this epidemic of loneliness report that he came out with a few years ago. But when you're lonely, you say, I feel so alone. I don't feel like anybody cares. And I think there's a lot of people that feel that way. And we can almost relate to each other about feeling alone, like no one cares, in a way. So we have to know that we're not alone in feeling that, and it's time to do something about it. And it's a really complex issue. It's so hard to know how to work on this, but we have to, because it does underlie so many of the food insecurity and domestic violence and crime and things that are going on in our communities. Just impacts our health. And you guys are seeing that with the older age community.
Yes.
How much, and how have you seen it impact people's health? I know you're seeing that.
Just their mental health. I mean, they're lonely. Sometimes they'll just call the helpline just to talk to somebody. I mean, it's because they really don't have, anybody. So it definitely affects. I know, we SVCOA, we also oversee the Meals on Wheels program, and a lot of times the volunteers who deliver meals will be the only person that person will see when they deliver the meals. So it's definitely, it's a big concern.
And that can lead to, early, increased risk for stroke and heart disease.
And they equate it. They equate social isolation to smoking. I mean, that's how bad it is for us. It's it's not good for our health.
Yeah.
So
no matter how much some of us want to be on our own little islands.
Right.
It's often we do that to protect ourselves because we've been through a lot of things in our life. So, but we definitely need to find people who we can be ourselves with. And feel seen and valued. So that's what we're working on that, and that's what the socials that we do are the monthly socials, which are also on our website. So the Social Connections survey, the kind of, people might be wondering what kind of questions we're asking.
And it's anonymous, right? It's anonymous.
It's anonymous, which is really important. We actually went back and forth for months talking about whether we could do a survey and whether we could how that people would feel comfortable taking this survey for all the different reasons, and a big reason making it anonymous. So, and also these are hard issues to talk about, like isolation and loneliness. You can actually experience physical pain from loneliness. So we were unsure of how do we do this survey and not hopefully not make people feel worse in the process. But honestly, at Whoopie Pie Festival, and we were also at the American Foundation for Suicide Prevention on Saturday morning, the Out of Darkness walk, people came up and they were excited that we had this survey. They were excited to hear that we were doing it. And I think even though they're tough issues, they're all very human issues that we can all relate on. And just even naming that. And a lot of what we do at Social Tinkering is name the hard things. We name that elephant in the room, because you can't solve a problem if you don't name the thing that we need to work on. So even though it can be really painful and we often want to hide from that, we're trying to name those things so that we can really start working on it together. So yeah, I think we have over 150 surveys have been completed, and that's not including the paper copies, because I haven't even been able to go through those yet. But I know we have probably at least another 15, 20 paper copies, another 20 after that outstanding. So we're only 8 days into this survey, and that says a lot to me that people want to share how they're feeling on this, that it really resonates.
And it's not too long. It takes about 7 minutes to take.
Yep, 7 minutes. And about a third of it is just demographic questions, like asking, like, where do you live in Rutland County? So we can kind of pinpoint, okay, people in Fairhaven are experiencing it in this way. People in Wallingford or in Rutland City are experiencing it differently. So that we kind of know when we go to focus our programming next year and our partnership work, we can know that the same thing that works in Rutland City does not work in Wallingford, or doesn't. The same thing doesn't work in Poultney.
Right.
And so we're asking that. We're asking age. We're asking, do you live alone? Do you live with a companion animal? Do you live with a family? We're asking people, do you volunteer? Do you, if you do, do you get out and socialize? Where do you go socialize? If everything comes back that people are very socially connected here, I'll be super thrilled. And so that's why we say everyone needs to take the survey, right?
Right.
Because if, it's a measure of how socially connected people are feeling and what barriers people might be experiencing.
Right.
If, so we want social butterflies like us.
Right.
Renee and I are social butterflies.
We are.
We want social butterflies to take the survey just as much as we want people who are really feeling this, these issues to take the survey, because everybody experiences it so differently, and we want to know where to start. Where is the place we need to push?
And how many ultimately would you like to have total come in?
We're aiming for 400. We've been told with the community health needs assessment they do every couple of years, the hospital or the health area, they get about 400 for the whole county. So I feel like that's a pretty good goal for us. We're going to be running this. We start at the beginning of September, so we'll be running it throughout the end of October, and we're already at over 150 in 8 days. So I'm feeling positive. We can hear from a lot of people on this. We'll be at lots of different events as well tomorrow.
Oh, our Community Health Day in Pittsburgh tomorrow, right? Which is tomorrow, I know already, it's here. And then we have one in Arlington, another Community Health Day coming up in Arlington in October, October 23rd from 12 to 2 at the Commons. So again, those are opportunities for anybody to come out and get some great resources and meet some great people. So we'll have those there as well. And if anybody has an event they want us to come to share about this, or just on the topic or about the survey, we're all very one of us at Social Tinkering or any of our partners, if they have a chance, we can go out and talk to folks. I know you've been talking to the students a lot already and such. So. So back to the survey, we talk about the demographics. That helps us really hone in who is experiencing things differently the most and such. And then we ask questions about how are you? How do you feel about social connection? Do you feel socially connected? And like I said, the volunteering and the where do you socialize? And then the last kind of section is, what might be preventing you from feeling socially meaningfully connected? And so that is really key, because, okay, we got the levels of how people are feeling, but if we don't know what's preventing them from getting there, then what are we going to do with that information? And so that third piece to the survey is really critical, to let us know where we need to push next year with our projects. And then all of this survey, we're also doing a landscape analysis, which has been a really interesting process. So we looked at what national guidelines are for the impacts of isolation and loneliness, what all the researchers say. And then we just said, okay, from our own life experience with isolation, because all of our team has different versions of, how we feel isolation and loneliness. So we're also saying from our perspective, what else is missing from that list of the impacts of isolation and loneliness. And we're saying, okay, so if harmful substance use is an indication that someone might be feeling isolated and alone, how are we doing
on recovery, and how are we doing on what are our statistics here in Rutland County on that issue? And then, so because we haven't, so there's a lot of information out there, right? There's already a bunch of information on youth, there's information on the aging population, and all these different issues. So what we're doing is looking at, there's that data from those different populations or the different issue. Nobody asked about social isolation, loneliness to get that data, so we can't like directly correlate that or say, you know, this is a cause, not correlate. We can't say this is caused by isolation, loneliness, because we didn't ask that question.
Right.
But we can look at that through a lens of isolation, loneliness, and social connection and say, if this exists and this is at this level, we can assume that there is some isolation, loneliness going on here that's feeding into that, perpetuating that. So we'll have that landscape analysis report, we'll have the survey results, and we'll make one big report at the end of the year. And then everybody says, what are you going to do with this?
I was just going to ask that.
What do you guys, what would you do with
I
that
will share it, and again, it's going to be very valuable to us to see the response and what people are saying, what they're feeling, and what they're asking. Really, what it's going to be, what they're in need of, and then doing, aligning our agency with how we can improve in serving them.
Yeah, and all of our partners that are working on this with us are going to get the results from this. Again, all anonymous. But it'll help us guide our work together. And so the really cool thing is, over the last few years at Social Tinkering, we've been creating this thing called Rutland Belonging Collective. And the idea is to really make it possible for anyone in Rutland County to have an opportunity to have access to building a supportive social network for themselves. And to do that, we're going to work with all the partners, bring them together in this collective effort to identify and reduce those barriers, new projects together. So the survey is one of our biggest project so far. It's our first project because we've been really pulling our partners together this year, and people can learn more about that on the website too, socialtinkering.org, and all the partners that are involved in this will take that information from the report, and then we'll know, okay, our first priority is to work on this barrier, and our second priority, third priority. And then, so the first task will be, okay, let's go pool our resources and figure out who has what capacity to do what thing, who has knowledge and skill to do that priority. And let's write a grant together instead of writing 4 different grants for social connection. Let's just write one, strengthen that ask. Funders will be really happy to see that. And then hopefully the work can get supported. And we want businesses involved because businesses here get asked all the time for money from nonprofits, right? So the other idea is let's make a group ask, go one time and ask them for an amount that helps all of us at the same time, and ask multiple folks so that not everybody's going to one group and asking that one person over and over again. And because I think, businesses are struggling with isolation, loneliness too. Right? You guys have a great workplace.
Oh,
you have an amazing connected workplace there.
We sure do. Very grateful for that. Yes. And the BOWS you've had funding from the BOWS.
Our current funding for all of this, and we are so extremely grateful, is the BOWS Health Trust. 3 years ago, we applied, focusing on, thinking about equity and social isolation and loneliness and how it all ties together. It definitely ties together, and equities really drive isolation and loneliness and divide people, and that inequity and discrimination really drives fear and things that drive us apart. and help us not understand each other.
Right.
So the Bowes Health Trust saw that 3 years ago. They supported this work. Our funding is with them for this grant is done at the end of this year, so we're looking for more funders going into 2026 to like launch the first project from this data, and continue this partnership facilitation.
Right.
And
So
the
again, this
advocacy
data
work.
is going to be so valuable going forth
Yeah,
with this.
yeah. We're so grateful for the Bowes. We've also had a lot of support from the Vermont Public Health Institute in the past, and Vermont Community Foundation, and Ben and Jerry's Foundation a few years ago when we first started too. So, yeah, we're a little low on funding right now, but we are just. It's challenging right now. A lot of the funding is going towards the most urgent needs of food security and housing, which is so extremely important, and also I believe impacts from isolation and loneliness. But we are going to persevere. We're not going to stop working on this topic because it is the thing that's making everything else persist. And it is that upstream cause. And if we don't work on that, we can't ultimately reduce those other impacts and heal. So let's see. So we want to hear from everybody as much as possible.
And it's through the end of October.
And through all of this, we hope to undo aloneness.
Yes.
So
Yeah.
when you have a group of people that surround you in your life, even if it's just 2 or 3 people that really see and value you exactly as you are and support you, it's incredible the difference it can make in your life. Those folks don't always, they're not going to solve the problems for you, but just having somebody who can give you the space and time to listen and care can make all the difference in the world. So,
well, hats off to you, Jeanette, for really founding this and directing this effort, because it really, we're so grateful, and it's wonderful to partner with you and to help with this. So, and I've already, we've already seen it work. We've seen people benefit. We've seen many people benefit from this, and I've been to some of the Gather Together events and other events, and it's just wonderful.
And your partnership has meant the world. It's undoing my aloneness as the founder, which I founded this based on my own life experience. To have that support going into this group, valuing that is we're doing this together. So I hope a lot of people check out our website, again, socialtinkering.org. You can call me anytime. I grew up in the 80s, so I'm all about phone calls. You can also text our phone number or email, and happy to talk to people, explain what we're doing more. People have ideas. We want all the ideas, all the volunteers, like all the things, like let's work. Let's just undo this aloneness together.
And folks are also welcome to reach out to the Southwestern Vermont Council on Aging anytime, calling the helpline. Again, we offer a variety of programs and services for our older adults in Bennington and Rutland counties, and we're happy to help.
And these guys are awesome. Like SVSO, they're so great. I've been to a few of their programs and worked together. They're so friendly and just down to earth and just open and kind and compassionate people. So, yeah.
Thank you.
Thank you for doing this with me today.
Thank you, Jeanette.